I'll just use the one thumb so you can see there on the camera. So we're sinking in, and this is normally a pretty hot spot, especially for cyclists that are doing a lot of repetitive hip flexion, that type of movement. Yeah, that's it. That's it there. You can feel a little nugget, as Ninj said before. Does that one have any referral patterns, Ninj? Or are you
vaguely, yeah. I think down my leg.
Down the leg, sort of, yeah.
It's all consuming.
Hey guys, it's the big dogs here. We got Ninja and Jace. So we're doing a comprehensive knee treatment on Ninja. So I had a client who's a woman and she does a lot of cycling. So either stationary bike for fitness or a bit of road cycling, and she's had a bit of knee pain. So I thought I'd show you what we do for a client that might be suffering from that sort of condition. So we're going to start with the quads, as they're a big, powerful muscle that attach onto the knee. Obviously attaching on at the hip as well, but yeah, quite influenced by cycling and that type of thing. So they're commonly overactive and overworking, and can pull that patella out of alignment, or can cause some issues down in the knee there. So I'm just going to start off with a nice broad stroke there and work our way through. So starting on that lateral line, because there's normally a few real tight, nasty spots out in that vastus lateralis and that sort of ITB junction.
You started off strong.
Started off strong, Ninj. Sorry, mate, I'm just leaning into it.
It's all good. I'm good. Don't know your own strength, do you, Jace?
No, that's it. Just got to lean the body weight and see what happens.
Yeah. Nice and slow.
That's it.
Give the body time to
adjust and adapt to the pressure.
Yeah.
So we're going within your boundaries and your pain threshold. So we're not going straight in and going as hard as we can straight away. It's building that trust and letting the tissue sort of allow us into the depth that it's comfortable with. And then we can slowly get in a bit further as you get a bit more relaxed into the session, and start to get a feel for what the session is going to be like. So we're just staying nice and slow, staying on that lateral line, working our way down. We can ask if there's any referral patterns, because quite commonly from this lateral line of the quad, you can get some pain down to the outside of the knee here, or it can go into the patella. So any sort of referral pains there, Ninj, for you at all?
No.
Some people get like a sharp sort of feel like their knee's going to almost explode, like they're getting a strong referral pattern down into that patella. So that can be quite normal as well.
Sorry for interrupting your video, guys, but I want to talk to you about the MMT Online Academy. So you might have been looking at Ninja and I doing our stuff for a long time now, thinking, how good would it be to work at MMT? But you might be overseas. This is your chance to get exclusive content updates from us every single day to make you a better practitioner, more new customers, better results, and skyrocket your income. So if you want to be on the inner sanctum, get into the Academy. All you got to do is dedicate 5 minutes a day to making yourself better, and it's just $28 per month. How good's that? $7 a week. Let's go!
So it's important to work the whole length of the quad there, and just feeling for any sort of really built up tissue that might be causing some pain, or restricting the quad to be able to work at its best.
In there I can feel quite a bit.
So there's a bit more down towards the knee there.
Trigger points.
Bit of a trigger point.
Yeah.
So what we can actually do is I'll spin around, we'll work up away from the knee, since we found that there's a bit more down there. You can sink down here, because we want to try and encourage the tissue to clear away from where it's blocked in. So we found down that sort of attachment point of the ITB. Sink in, and then slowly start to work away. Staying connected through there. How's that one there, Ninj?
Good. Look, we got a bit of special guest.
Special guest.
Special guest. Look at this bloke.
Dance is coming.
Oh yeah. Get into me.
There you go. Little cameo from Dars. You never know what's going to happen in these videos.
Getting ready for his turn.
I promise that doesn't happen if you actually come in for an appointment. You don't just get random people walking in, shaving your chest.
That was good for a giggle.
Yeah, good for a little laugh. But so now we're getting a bit more direct with the thumb. So I've sort of sped up a little bit. I could do more broader strokes, but I just want to show you the money spots and the key areas that we can target. So typically right where this ITB attaches. It's pretty nasty in there, and then we can really scoop up. There's a spot just off, yeah. So just an inch or two up above the knee there. There's normally a nasty little trigger point, even if I drop under that one. And does that come back down, Ninja, or are you pretty localized?
Yeah, you can feel it where it attaches onto the bone down
back
there.
Down here, yeah.
But directly where you got it, it's like it feels this real therapeutic sensation.
Yeah.
You know it's good for you. So imagine if you have got knee pain, it's going to be fucking zinging, isn't it?
Yeah, that's it.
Yeah.
Absolutely.
So, yeah. But you love it at the same time. You know that everything's being addressed and you're going to be better in the future.
So there, we can actually do some work directly on the knee there. So on the side of the knee, so in through here, there's a lot of fascia and connective tissue that crosses over this area. So yeah, not a lot of people actually treat directly on the knee there. But yeah, this is a spot where it can get quite built up and scarred up, particularly if you're doing repetitive movements or if you've had maybe previous knee injuries. If you've got a lot of tight tissues around there, the knee can sort of become a bit compressed. So yeah, just trying to open up and release some of those connective tissues there. Create some more flow. That's what it's all about. Getting some flow back through the body. So once we're happy we've targeted that line, we'll actually do a bit more work up through the middle of the quad. So we can go a bit more with the elbow here. So just going to sink off so we can pick up the slack and then just drop off the other side into that quad tendon. And then we're going to slowly work our way up. Sorry, Leo, I probably blocked your vision there. And then just slowly working our way up. We can just change our angle slightly, seeing if there's any more on that medial side. Yeah, a bit more medial.
Yeah.
And then once we feel it soften up, we're just allowing the stroke to flow through it. So I'm not really trying to push through a move really quick. It's just whatever the muscle and the tissue's allowing me to move at. So you can sort of sense when there's a pathway that's being cleared. Like now, starting to move a bit quicker. And then we might feel that we come up to a spot that's a bit more solidified and need to slow down and just hold it. Wait. And then we can move through again. Keep going all the way up. Don't want to miss any of the gold. So you can see it's moving a bit freer there, so there's not too much up in the top of the quad. So that's a good indication we don't have to worry about spending too much time there. And then we can sink out. And we'll get one more through the medial line, just down here where the VMO and then the adductors come in as well. So this is also a pretty nasty line that can get a bit sharp. So we're just going to slowly sink there. And there's the
I'm good. Yeah,
normally a little hot spot just in that fascial intersection.
just in about here is where a lot of people have
Yeah.
that nugget.
Yeah.
Can make your whole quad feel like it's
on fire.
Yeah.
Sometimes it'll refer back into that medial part of the knee where you might be feeling your pain.
just there for me. Tight,
Yeah.
sore.
Just give it some little wiggles, encourage it to free up. Keep working. And then we'll go one with the thumb, and then we'll move on and keep working around. Keep showing the key spots. There's so much at play at the knee. This is what we can come up with. There's so many different areas that can contribute to knee pain. It can be joints below, joints above. I mentioned in a previous video that there's a concept in the body known as the joint by joint theory. So joints have a primary role of either mobility or stability. They obviously have both included, but they're biased more towards one. So with the ankle, generally it is wanting to be more mobile. So you want to still have stability, but you want it to be mobile and moving. But a lot of people, due to being in poor footwear and not moving around barefoot or having previous injuries, the ankle becomes restricted and doesn't have enough mobility. So then a joint above tries to overcompensate for that. So the knee, which is supposed to be a stabilizing joint, then tries to become more mobile. So that could be why you're starting to get more issues in the knee. If your knee's trying to create more movement for the ankle being stiff, or it could also be the hip as well. If the hip's not having enough mobility and you're restricted through your hips, that could be flowing on down and your knee's trying to get more movement, create more movement in the body. So that's things that we can also look for in our assessment when you do come in for a session. All right, and then what we'll get Ninja to do is we'll roll onto your side so you can face the camera. So facing this way. And then your top knee up on the bolster here. There we go. He's a good client, he's figured it out. So we're just going to do a little one called our TFL in the side of the hip here, because this one runs down into our ITB. And there's also commonly a nice little trigger point that can refer pain down that outside of the leg. So I'll just use the one thumb so you can see there on the camera. So we're sinking in, and this is normally a pretty hot spot, especially for cyclists that are doing a lot of repetitive hip flexion, that type of movement. And yeah, it can get overworked and pretty angry in there as well. Yeah, that's it. That's it there. You can feel a little nugget, as Ninj said before.
Yeah.
Does that one have any referral patterns, Ninj? Or are you pretty...
Vaguely, yeah. I think down the leg.
Down the leg, yeah.
It's all consuming. You get a good TFL running spot. Yeah, just can't think of much else. You're pretty present.
You're pretty focused on the spot at the time, but I feel like TFL is one that you almost have that instant relief. Like as soon as it's done, you're like, oh, your hip just feels so much freer. You have more flow going down your leg. So yeah, you've just got to endure a bit of discomfort and you'll get a lot of relief from it. Yeah, it's only a small muscle, but yeah, it does quite commonly impact a lot of hip pain, but also can be knee pain as well. And just slowly trying to find where it is. I feel like angling that way has got a bit more bit more of a Ninj.
Yep.
And then once he's had enough of that one and we feel like we've released that off, we can get him to roll over and we'll start to work through the back of the knee. So this is a spot where some people might not have had a lot of treatment. So people typically, when they think of the knee, they'll treat a lot more through the quads, which we've already done. But yeah, when you get pain in the front of the knee, it can also be coming from the back of the knee here. So there's a muscle called popliteus, which runs over the back here and attaches on the medial side. So it actually starts above the knee here and then wraps around behind and comes over here. So it's a really thin muscle, but what it does, if there's dysfunction at the knee, it can actually lock on and restrict the ability of the knee to move properly. And so if we just sink in first, and then if we start to flex the knee up, we'll feel just a little ball that pushes back into my thumb there. And we're just going to slowly pin it. We can start to encourage a little bit of movement. And there's a bit of pain in there for Ninja already.
Yeah.
So yeah, it's a small muscle, but it's quite commonly involved with a lot of knee pain, particularly chronic knee pain if you've had any ligament issues. But yeah, as I mentioned, if it's just you've had imbalances around the knee and yeah, you might have been overworking through that knee for various reasons, whether it is that other joints aren't moving correctly or muscle imbalances, yeah, this one can limit your ability to flex the knee, but also fully extend. So it can limit its full range there. So that's why we can bring it up and we can really feel if it starts to get stuck and compressed. But we're also checking if there's any referral patterns. Sometimes it will shoot up into the hamstring, or it can refer pain around the knee as well. And then we're just slowly going through a bit of passive movement there. So it's a really important one If you haven't had this spot fixed, highly recommend going. If you're seeing a practitioner you don't have access to us, mention the popliteus, see if they can stick their thumb in it and work it, release it. It might be the spot that's been missed in your treatments. So it can make it feel like you've got a lot of sort of joint pain because you're obviously limited in your range of motion. But once you release it, your knee just feels so much freer. You've had previous knee injuries, haven't you, Ninja? You've had previous ACL, ligament ruptures and tears.
Yep.
So you're pretty acclimatized to the popliteus locking on. But what does it feel like for you when you get it like when you first got it released?
Yeah, it's just that you got a pain in the back of your knee, and what it's doing is really restricting you from being able to bring your heel to your bum. So once you kind of release this muscle off, then you can get full range back because it's sort of stabilizing your knee while those ligaments have been ruptured, traumatized. So they are hanging on. But once the healing has happened, they don't need to do that service anymore, that purpose. They don't have to do that job. So you can release it off, and then the muscles that can do their normal job again. So but there's a knowing when you have it done that it's the right thing. So you can leave that in there, stabilizing the knee while that healing's happening. So you don't want to release it off too soon after a rupture. So you can heal an ACL, a full ruptured ACL, naturally as well. The body will heal it. So there's been a school of thought that you had to have surgery, but it's in the last 10 years it's been a lot more common not to have surgery.
More common, building back natural strength around the knee, really targeting the muscles. Yeah. So the last one we're going to finish with is the hamstring. So cycling does recruit a lot of hamstring as well when you're pulling yourself back through. So these distal hamstring tendons can get really tight and ropey as well. So we can just pin and work it as we go up, or we can start to do some of this more passive release work. So just sort of flossing through those tendons. And again, gives us a bit of a gauge of what's going on in the hamstring as we're flexing and extending the knee. You can feel if any spots really pop up under our palm. And then we can go back and target them a bit more. Not too bad out through there though. So we're going that lateral line of the hamstring. And then I'll go one more with the elbow to finish off. We'll go a bit more in that medial line. So picking up there, sinking in. And working through. Again, we can even roll over a bit more into those adductors. Seeing what's there. And then continuing to work through. Feels pretty good through there.
Yeah.
It's all pretty clean. Nothing in the hammies for Ninja. Alright, so there it is. There's a comprehensive knee treatment if you're a cyclist and struggling with some knee pain. Look at the muscles around, but you can also assess joints above and below the knee to see if they're overcompensating and restricting and causing that pain in the knee. So thanks guys, stay tuned, plenty more content coming out.
Yeah.
See ya.
Done. Like, subscribe. Get it done.